Welcome to the Power of Peacefulness podcast. You don't want to miss today's episode. We're going to be speaking to Grace Guffey, who is a counselor. Many of us are in toxic relationships. It occurs over and over again. And we're going to be talking about why that happens. You'll hear some skills that you can walk away and start implementing today. This podcast, The Power of Peacefulness, it's all about bringing peace into your life. So if you haven't downloaded our workbook yet, go ahead and do that at SharonMcLaugjlin.com/workbook. Hey everybody, today we have Grace Guffey with us. She's a licensed mental health counselor and she specializes in adult attachment therapy. We're going to be talking about different attachment issues that show up and what we can do about it. Grace, thank you so much for being here today.
Yeah, thank you so much for having me. I'm really excited to be able to talk to people about, I think, an issue that many people are experiencing around the world. And so I'm happy to talk more about it.
I always ask our guest, how did you get into this? I always love to hear the background. Was there a personal interest? Obviously, because you're doing it. Anything from personal experience or perhaps a friend or a family member?
Mm-hmm. Well, I think like with many other healers, there's always some sort of similarity and into what they go into. And I'm no different, right? I have gone through a lot of difficult circumstances throughout my life. I am an abuse and assault survivor, different times of my life. And I was suffering from a lot of the impacts of complex trauma for a long time. Didn't know what it was and, struggled with addictions for a long time as well. And so kind of finding my way into the helping field actually got redirected. I was in the military for quite a long time when I first started out. And I decided I wanted to do something that was focused more on helping people one-on-one. And I just always have a special interest into human behavior. And the more I learned, the more I got through grad school and started doing my residency before licensure. I started out in the addictions population, which is a tough one to start in, but gave me a lot of foundation in exploring and understanding the depth of this problem. And throughout my experience counseling, I had found these are complex attachment traumas that are the core of these problems that you see when people are stuck in toxic relationships, or they're struggling with addictions that cope with all of the consistent traumas that they have experienced throughout their lives. And so essentially they become barriers for people to having healthy relationships. And so my own journey kind of mirrored a lot of that too.
For those listening out there, could you describe what an attachment trauma is? A little bit more in depth.
Yeah. So when people think about traumas, right, they might think about PTSD, and that diagnosis essentially kind of focuses on how trauma impacts humans' behavior. And it's more looked at one particular trauma. Now, complex trauma, it's also known as attachment trauma or relationship trauma. This is complex chronic traumas that someone has experienced throughout their lives. And it can start as early as in their infancy. And when we're talking about attachment traumas, we are looking at the person's attachment system. So I think there's a lot of discussion these days. I think people are generally understanding attachment styles. So they understand there's main character categories. There's anxious attachment, avoidant attachment, secure, and then of course, disorganized. Disorganized attachment is a reflection of someone who has experienced abuse and trauma. So complex traumas may not be huge traumas like assaults or extended abuse. A lot of times it could be emotional abuse, people who grew up in narcissistic families that experience that level of emotional abuse. And what it does is it disrupts the person's development of their attachment style, meaning they end up creating trauma responses that get reinforced over and over and over again until the brain is fully developed, which is in your mid to late 20s and sometimes into your mid 30s. So all that time that's being spent to reinforce these cycles, those are the survival mechanisms that actually ultimately sabotage their adult relationships in the future. So when we're looking at attachment traumas, we're healing those core experiences from early on and connecting those cycles and patterns that they're replaying in their adult relationships that continue that trauma cycle. So attachment trauma is healing those survival mechanisms.
Could you provide us with some tips? Where do we get started with this? Like, if someone realizes that they're listening, or they just realize that this is a recurring theme in my life, it keeps happening over and over again. Where do you suggest they start?
First step that is important with anything, I think it's educating yourself. A lot of times, like I even said in my own journey, so long ago when I first addressed the addictions, I thought that was it. But addictions is always like the tip of the iceberg. And so educating yourself to understanding more of why that pain is there and those traumas, understanding what those diagnoses look like, what do the symptoms look like, what do your behaviors look like, understanding that the dysfunction that they're seeing is an impact of trauma, not a reflection of them being bad people. So educating themselves first is an important step.
Okay. You spoke a little about finding a therapist and how important that is. We had spoken before the podcast. So talk to us as far as how would somebody find a therapist that is like an attachment-based therapist? How would they know that that person is an attachment-based therapist?
Yeah, and this is a really good question and something that I really want to emphasize. With this particular work, with trauma work, it is super important to find a licensed therapist. There are many people out there that can just call themselves therapists. These are many of the life coaches. Now, coaches can also be helpful when it's, problem focused, singular focus, and they've had some training, but often they don't. So this kind of trauma is very nuanced. It can be very complex, and it's so important to find someone that they trust and feel safe with, and someone who has had much training and education to identify those nuances. So to find an attachment-based therapist, you can go to psychologytoday.com. That's the main directory for most therapists in the country. And so you can put a filter there. You can filter through your insurance. You can also click attachment-based. You can also filter through other problems that they focus on, which would indicate that they're an attachment-based therapist. So looking at CPTSD, which is complex PTSD, PTSD, borderline personality disorder is also a common diagnosis. So looking for therapists who are trained, licensed, and specialized in that, and who are also trauma informed, those are the types of providers that you really want to look for.
We speak a little about the effect of attachment trauma on the brain.
Absolutely. So I tend to really like to look at the neurological impacts of trauma, but I think that's also really important with any trauma-informed professional, that trauma impacts the brain, and understanding how the brain is functioning allows you to step out of that judgmental mind that allows someone to have the motivation to change. A lot of times when people come in to do this therapy, they're coming out of a lifetime of shame. And so part of the healing is to be able to understand their behaviors from the lens of compassion and objectivity. So trauma impacts the limbic system of the brain, which is more of the primitive part of the brain where all the survival mechanisms are. And so, like I mentioned before, because the brain takes quite a while to develop, more specifically the prefrontal cortex up here, because it takes so long to develop, that part of the brain is the one that allows us to think of consequences, to think abstractly, to be able to put things into context. So the limbic system does not do that. All it does is react to threats. So when you're experiencing trauma, it impacts the neurons of that part of the brain. And so it misfires and it sends these messages of, we need to survive. We need to be in a trauma response. But that trauma response might have been helpful in that trauma, but not in the relationships where you might lash out or you might fawn. So understanding the impact of the brain allows you to understand why those behaviors are there and gives you kind of a pathway to learning skills and tools to change those patterns. And then they have the opportunity to have healthy relationships. And when people have healthier relationships, they create connection. And I think on an individual level, when people heal that, it impacts the rest of the world, which is why I think this work is so important.
Talk to us a little about some of the recovery skills that you offer, and this is not individual therapy. We do have to add that disclosure. Just in general information about some of the recovery skills that one would see if they were doing this type of work.
So with this also, just a little note with looking for a provider, this would be another thing to filter for if they specialize in dialectical behavioral therapy. So the trauma recovery skills in the course that I have consist of those particular tools. Those tools are centered on helping people learn relationship skills and emotion regulation skills. And those are the skills and tools that essentially were needed when they were younger, but their brains weren't developed. And oftentimes people did not have role models and they didn't learn these skills. And so these skills, like for example, emotion regulation, one of the most important skills I teach in that section is check the facts. So when you are triggered by your attachment wounds, one of the things you have to realize and why we focus on the brain is that the limbic system distorts our reality. And we have to understand how to tell the difference and check the facts. This emotion regulation skill walks you through steps and retrains you to recondition the brain to go, this emotion I'm feeling at the intensity I'm feeling, does that fit what's happening in this situation? What evidence do I have that is showing me that this is what's happening and this is why I'm responding? And by using that tool, it helps them strengthen their ability to tell the difference between, am I sensing a real threat that I must address? Or am I perceiving a threat and I'm responding with a trauma response that potentially sabotage my safety or sabotage a healthy relationship?
A little about break the cycle of trauma and abuse. We hear that right? Like, let's break this. Right? We realize it's occurring. We're getting therapy. What do you think are some of the factors that play into actually breaking this cycle?
So I focus on a very particular part of this cycle too. I work with adult children that are going through the process of no contact with their parents. And I also work with some of the estranged parents. And I am definitely seeing a generational gap just for one, different factors. But one main factor is, the lack of information and access to mental health studies and information that our previous generations didn't have. And so there was different parenting styles. And the generation before, unfortunately, had not the greatest information. And so when we're talking about breaking the cycle, we're talking about breaking those perpetuated cycles that were learned in childhood and they're impacted from their parents. And the thing that I've noticed in working with estranged parents is that they also experience their same cycles of abuse from their parents. And especially when it comes to the mother wound and that maternal wound going through the generations. Biologically, when a female is pregnant, and if they're experiencing trauma and dysfunction at that time, the baby that is in your utero is impacted. I forgot the release of that particular hormone, but it impacts the parts of their DNA that make them more hypersensitive, their nervous system's more hypersensitive. So it's being carried along biologically and behaviorally. So when we heal these, we heal also relationships throughout the generations. But I think also in the grand scheme of things, especially with the state of the world and the disconnect, I think it's so important because if we heal these traumas, we do become more empathetic. You become a lot more present. You're a lot more understanding. And that is the pathway to peace, which I think all of us are searching for. But it has to start in this individual level where people have to address the generational things that they're carrying, generational curses, the hurts, the things that their ancestors are asking them to heal.
You mentioned peace. It's all about power of peacefulness here on this podcast and how important it is to have peace. And with all the things that you mentioned, you could see why there would be a healthy relationship, right? Because you're actually addressing rather than sweeping under the carpet.
Yes.
I want to finish, before we get to your course, I wanted to mention as far as some people will say, like we talked about, they have this theme over and over again. How do you identify early on maybe a abusive relationship or a toxic relationship? And I ask you this because I see this over and over again. From the outside, it's very easy for me to say, that's a toxic relationship. Why does that person continue? But I think for them, when I speak to them, it's like their norm. They don't know any other way.
Yes. And that's kind of the suffering of trauma as well, that it does distort your reality. But also if you grow up with that kind of dysfunction and that's all you've known, it is hard to break that. on a conscious level, I know many people recognize this hurts me, but it's almost like an addicted kind of factor that in these trauma cycles, they're replaying this same cycle that was created early on with their attachment figures. And with complex trauma, it's somewhat centered around the inability to trust. So if someone is wondering if this applies to them, they can look at what kind of attachment style they have. If they have an anxious or avoidant or disorganized, that can give an indication that there are attachment wounds. If they look up complex PTSD and they're resonating with those symptoms as well, it may also indicate that there's attachment traumas. That would mean that they're just replaying that cycle in toxic relationships. And if they see themselves falling into one of these 4 trauma responses, which I go over in detail in the first section of that course, fight, flight, freeze, and fawn are the 4 trauma responses. And if they're constantly in relationships that are always conflict, always fighting, they may want to understand that. Or if there's a flight response and they're breaking up before being broken up with, or ghosting, or just leaving, that's the flight response. Fawning, people pleasing, having no boundaries whatsoever, and just allowing themselves to be stuck in abusive relationships. Or freezing, they're experiencing these PTSD symptoms where they disassociate or numb, and they kind of avoid a lot of avoidance in that response. So if they see those things, it might be helpful to kind of look into their attachment styles, their attachment wounds, and if they resonate with complex PTSD symptoms.
Grace, this has been so helpful. Let's talk about your course. I know it's Unteachable. It's attachment trauma therapy. Talk to us, like, why you created it, what's in it, if people want more information, how they can find it.
Yeah, absolutely. If you follow me on social media at Attachment Trauma Therapy, or you can type in Grace Guffey LMHC, on my link in bio, you can always click on that and find it. But on Teachable, the trauma recovery skills course is divided into 4 sections. So you can take whichever one if it applies to you, but I definitely recommend it's helpful to learn all of it. The first section is deconstructing trauma. That's where you're going to learn everything about, the symptoms, how your brain is functioning, how your brain has been impacted by trauma, and getting a clear picture of your attachment trauma patterns. And I teach you a major skill at the end of that allows people to identify it themselves. And then the next section is relationship skills. So a lot of these things none of us have learned. And so when you're struggling with toxic relationships, you have to learn different strategies to actually be able to have difficult conversations, to be able to repair in relationships, because that's crucial. And then emotional regulation skills. Those are the skills that are needed when you're dysregulated and you need to address something with someone, or you're not sure what you're perceiving. And those are those tools for that. And then the final section is distress tolerance skills. These are specific skills for the nervous system. When you are really, really dysregulated, you're really having severe symptoms, and you need to just bring the nervous system back to a stable place before you can make sense of why you're triggered. So these skills are designed to help people learn the tools to break down those patterns. Oftentimes, if you start this and you're getting a lot of problems or barriers and you're having a really hard time, probably a good idea to find that attachment-based therapist so that you have a place to process what you're trying to put into practice.
Grace, this has been excellent. You're very strong. I'm so glad that you're doing this work.
Me too.
I believe that this will be extremely helpful for our listeners. So remember, find Grace on Instagram. She has I was able to come across her. Love the account. Love all the work that you're doing. It's so important. And thank you for specializing in this, because there's a lot of counselors that are more general, but this requires a lot of work, deep thought work. And so thank you for helping others.
Thank you so much for having me.